Hi, I'm Dr. Alex Malime from Orthosnap. First, congrats on taking the first step towards your best smile. In the next few minutes, I'll show you how clear aligners work and the simple habits that make treatments faster, safer, and more comfortable. Successful treatment requires a partnership of responsibility between your dentist, us, the aligner company, and you, the patient. Over these next few months, we'll work hand in hand to monitor your progress so we can achieve a beautiful smile with a functional and healthy bite. Let's get right into it. First, we're going to talk about how aligners work. Aligners apply gentle and constant pressure. That signal tells the bone around your teeth to remodel so that your teeth can move. So when your aligners are off for too long, your teeth actually begin drifting back. So consistency is everything. This means you need to wear your aligners for 20 to 22 hours a day. You'll only remove them to eat meals, brush, and floss. Orthosnap actually has some unique features that differentiate it from other aligner brands out there. For one, our aligners are manufactured to a higher precision, which means they actually grip the teeth better. Plus, they are ever so slightly thicker, which means they can move teeth more effectively. Because of these qualities, you may notice that fresh Orthosnap aligners can sometimes be a little difficult to take off and put back on. But this design feature is intentional. It moves your teeth more predictably, and you'll get better at it with practice. Next, the Orthosnap aligner system is incredibly smart. We pair it with AI-powered remote monitoring technology called dental monitoring to keep tabs on your progress weekly. We do this not only to ensure that each aligner does its job, but so that we also know exactly when to advance to the next aligner and when we need to adapt and make changes. You should have downloaded and activated your dental monitoring app on the day you receive your first set of aligners. This app will provide you with the guidance on when to scan and when you can move on to the next aligner. Your dentist and the dentist working at Orthosnap will be checking on your progress regularly. This ensures that we can progress your treatment accurately and safely without the need for so many in-person visits to check progress. Your dentist may have placed small tooth-colored attachments or buttons on your teeth. Think of them as handles that help your trays grip and move your teeth more precisely. Your dentist may also do IPR, or tiny polishing between the teeth, to create room so your teeth can align harmoniously with each other. New trays can feel snug, and your speech may sound different temporarily when you're first getting used to aligners. You may experience some mild tenderness, which is totally normal. Tooth movement can cause some soreness, and soreness is usually a sign of orthodontic progress. Your dentist might prescribe Tylenol or Advil if the discomfort is severe, but the vast majority of patients do not require this. Your bite can also feel off between trays, but that usually evens out by the finish of your case. In your aligner kit, you should have received a little white pouch with chewies. These are pretty important to assist in your case progress. They are small white tubes that are used to make your aligner seat more completely onto your teeth. Plan on using these for about 5 to 10 minutes twice a day. Hold on to one end with your hand and bite onto the other end repeatedly. My recommendation is to put one in your car, one next to your bed, or at your desk to make it more convenient to use it. But as these push your aligners more completely onto your teeth, it'll make your aligners more effective at moving your teeth. And the goal is that by the end of the week, there'll be no more gaps between your aligners and the teeth. As we mentioned earlier, you will need to wear your aligner trays for 20 to 22 hours daily. Remove them to eat. Water is fine with trays in, but dark or hot drinks can stain or warp your aligners. So to clean your aligners, you can use a soft brush with clear soap. But if you're willing to make the investment, my recommendation is to purchase an ultrasonic cleaner online for simple and hands-free cleaning. I personally use this and love the convenience and thoroughness. In 10 minutes, your aligners will look almost new. When you travel or you go out to eat, always carry your case with you. If you put it in a napkin and set it aside, there's a very good chance that someone will throw them out. For sports, remove your trays if you're using a mouthguard, but make sure to reform your mouthguard weekly in hot water so that it fits properly and protects your teeth. Most Orthosnap patients are instructed to wear each tray for 7 days, though that might differ from your exact treatment plan. If we change aligners too fast, that can stress the teeth and cause damage. If we move too slowly and wear the aligner for a month or longer, the aligners can wear out, and we want to avoid that. So how do we know when is the perfect time to move on to the next aligner? When it's time, you'll get a notification from Dental Monitoring app to scan your teeth. We then use the scan results to check your progress and verify if it's time to advance. You may also notice that your dentist and Orthosnap can send you messages in the Dental Monitoring app. And while this is great for progress notifications or feedback, if you actually need to schedule an appointment or report a more critical issue, you should communicate with your dentist directly, not through the app. Let's talk about your first scan. Your dentist will do a baseline scan when you receive tray number 1. Keep wearing that tray for about 7 days. On the morning of day 7, you'll scan again to see if you're ready to advance. If everything is tracking, you'll get the green light by evening to switch. If you had a rough week though, and you got a no-go instruction, just keep wearing the same set of aligners and you'll get notified when it's time to rescan, usually in 48 hours. Our goal is to ensure that the full movement goal for each aligner is achieved before moving on to the next aligner step. These small corrections now often prevent big delays later. But we've got good news for star patients who make the extra effort to wear their aligners as prescribed. If you scan on time and we confirm great tracking 3 weeks in a row, we may shorten your wear cycle to 6 days and then to 5 days after another 3 strong weeks. We won't go below 5 days, and if a tray needs more time, we'll recommend it. But this will help you move through your treatment faster, more efficiently, and still safely. Another thing to note is that Orthosnap manufactures trays in batches, not all up front. They're built just in time for your real-time progress. Why? The fact is that across the industry, over 90% of aligner treatments will drift if we never make adjustments. So these cases are usually resolved by adding extra aligners and extra time to the end of treatment. At Orthosnap, we want to avoid these delays. So we use these remote scans to adapt your treatment plan and make the next batch fit perfectly. That means that every tray will pull its weight and that we can ensure your case is staying on track. If you lose a tray or a tray cracks, don't panic. Reach out to your dentist immediately to inform them. We'll collaborate with your dentist to advise you whether to advance to the next aligner, go back to the last aligner, or come into the dentist immediately for a replacement. If an attachment comes off, keep wearing your trays and schedule a replacement. Finally, I just want to say, you've got this. After a couple days, wearing your aligners full-time will feel completely natural. To recap, wear your trays 22 hours a day, scan on time in the mornings, start the new ones at night, and we'll guide you step by step. If you have any further questions, direct them to your dentist as they will be directly managing your unique case. You can check the description below for more support links, and we look forward to showing you your best smile.